and that's how I got there. But it was wonderful work. It was perfect. In that job, in those days, I really felt like an independent practitioner. I had my assignment. I went, and at that time, the Detroit Visiting Nurses Association, which was a marvelous agency, it was run by women, right? Mm-hmm. And the executive, Emily Gleason Sargent, was tough. She was an excellent leader, and she was an excellent manager, and she knew how to put the boys in their place. She ran with the big boys, and they were able to do marvelous things at that organization. But they offered nursing care. They did maternity nursing, because in Detroit, there were still people who did not have access to hospital maternity services. So they were delivering babies in those parts of the county where there were no hospital beds available. Mental health services, they were doing, going into the factories and doing industrial nursing. So it was an organization that offered a generalized program with plenty of specialists. And there were medical consultants as well as occupational therapists, nutritionists, and physical therapists, and social workers. I learned a great deal, but I was independent. I knew that my work was essential. I knew that it made a difference in the quality of life for individuals and families. And so I was really proud of what I was doing. And it was very fulfilling. I got a great deal of satisfaction out of that work and would have stayed forever until they pushed me out to get my master's. And after I got my master's degree, I went back. I worked there as a assistant district office supervisor for 3 years, and they said, it's time, you need to do something else, it's time. But my dean, my advisor from the master's program at the School of Public Health in Ann Arbor, they got on the telephone and talked about it. And that's how I got to Tuskegee Institute as a faculty member, helping them to develop their public health program and to have that program accredited in public health for the first time in the history of the program. But it was, these people who not only taught me, role modeled, but they mentored and continued to network and advise me throughout my career until they were no longer able to do it.
You mentioned Tuskegee Institute, which is one of the places where your life intersects with Mary Starke Harper's in the sense of both of you have history there. But you also have other things in common, I think, in terms of where you invested your energy and what kind of values you showed. Can you talk about that a little bit?
Well, in the 50s, in schools of nursing, which were much smaller places, you were required, and I do mean required, on a monthly basis to go in and have a little chat with the dean or some other significant person in the School of Nursing and tell them what you thought you were going to contribute to improve society. You had to really, and at first I thought, why are these people making me fabricate this stuff on a monthly basis? And, I've got to think of something, and they're sitting there looking at you so intently and, you're struggling. But finally it hits you that they were forcing each one of us to think about who we were and how we fit into things. Mm-hmm. And to express that, they had very clear notions about professionals and how much the community had invested in them and what they were required to do, what they were obligated to do, because the community had invested. The dean had a little speech that she gave from time to time that went like this: you think that your parents have paid for your education, but what your parents have paid and what you have gotten through scholarship is insignificant in comparison to what the community has invested to keep this institution here for you, to keep it going so that you can get this education. You must repay that. And the way that you will repay it is through the application of the knowledge and skill which you have gained in this institution. And so when you left, you knew that that was an expectation, and that you didn't go there just because you wanted a good job or you wanted to say that you were a professional. You went because you had something important to do. You had important work to do, and it was essential. And so I always wanted, whatever I did, I wanted it to apply to my community that had been so supportive and so helpful in assisting me to get this education. It didn't come easy. Mm-hmm. My mother borrowed my first tuition, which was a mere $66. She borrowed it. I was 16, I went to Wayne, and I immediately lost the little flannel change purse that I had put the money in. I went into a telephone booth because registration was just awful in those days. And somebody had asked me a question which I couldn't answer, and I went in to call home to get the information. I had this little flannel purse. I had the $66 plus change in it for my bus fare. And I lost it. I left it. And what do 16-year-olds do? I started blubbering. I got up to the window to pay my tuition, and I didn't have it, so I just cried. And some young man came and said, "What's the matter? What's the matter?" And I said, "Oh, I went into all of this." And he said, "Well, dry your eyes and let's retrace your steps and see if we can find it." So he went with me station to station, and finally, there was only one thing he said left to do, and we went to Lost and Found, and the man said, "Describe it." And when I told him it was just a little purple flannel purse, he said, "Okay, here."